Get this, everybody. We are diving deep today into a question that I think honestly is on everybody's mind these days. Can AI actually be better than us humans? Like at diagnosing you when you're sick. And we found this super interesting article in the New York Times. It's about a study. And let me tell you, the results are pretty wild. I mean, it's going to make you think twice the next time you go to the doctor's office.
It's funny because this whole idea of an AI doctor, it's not exactly brand new, is it? I mean, researchers, they've been kind of messing around with this concept for, decades, really. There were some early programs, way back when, like Internist 1, I think it was called. And those actually showed a lot of promise, but they never really made it out of the lab, into the real world.
But this new study, this one feels different. They took 50 doctors, and it was a real mix, experience levels, everything from residents all the way up to those super experienced attending physicians. And they gave them these medical cases, 6 of them, to diagnose. But here's the thing. Some of these doctors, they had ChatGPT 4 to help them out, as a resource, and others were just on their own.
And, it's important to point out that these weren't simple cases. The researchers, they picked out these scenarios, these cases that were really trying to diagnose. But they were still, realistic, the kind of stuff that doctors run into every day. So it wasn't just some theoretical thing.
Yeah, no medical trivia night here, right?
Yeah.
So get this, the results were kind of shocking. ChatGPT, all by itself, it got a 90% accuracy rate diagnosing these cases. The doctors who were using ChatGPT, they averaged 76%, and the ones who were going solo, they only got 74%. And come on, that's a pretty big difference.
Yeah, it is. And what's really interesting to me is what this means, for how we think about AI in medicine. There's been this whole back and forth about whether AI needs to think like a doctor to be good at this stuff. And this study is saying maybe it doesn't. And that opens up a whole bunch of new possibilities.
Yeah, so the article actually dives into one specific example that really brings this home. It's about this 76-year-old guy who started having really bad leg pain after he had an angioplasty, fever, fatigue. His lab results were weird. It's a real medical mystery, right?
It is. And the diagnosis is what makes this case so interesting. Turns out it was a cholesterol embolism. Basically what happens is these little pieces of cholesterol break off from the plaque in your arteries and they block blood flow. And it's not the easiest thing to diagnose, especially because this guy had just had this procedure.
Yeah, definitely not a textbook case.
Nope. And the article points out that these kinds of tricky diagnoses, they can really trip up even experienced doctors.
For sure. So the article talked about how this kind of diagnosis can really throw doctors for a loop.
Yeah, exactly. And what it really shows is how much cognitive biases can affect things in medicine. Doctors are just like everyone else. They can get stuck on an idea, even when there's new information that goes against it. And that's why having something like ChatGPT could be so helpful. It's like a fresh perspective.
Yeah.
That can challenge the way you usually think.
Okay, so now this is where things get really wild. The researchers, they took it a step further. They actually looked at the chat logs between the doctors and ChatGPT. And get this, a lot of the time when ChatGPT suggested something, a diagnosis that the doctor didn't agree with, the doctor just ignored it.
That is classic human overconfidence right there.
Yeah.
We all do it. We get more sure of our beliefs when we think we're the expert. It's almost like we ignore evidence that goes against what we think, even when it's coming from a really smart AI.
Yeah, and here's the other thing. A lot of the doctors, they didn't even use ChatGPT the right way. They were using it like just a basic search engine. Instead of letting it do its thing, analyze all that complex medical info and give them these nuanced insights. It's they had this amazing tool and they were only using it for the simplest stuff. And that's a big takeaway here. It's not just about the AI itself. It's about whether we know how to use it properly, It's about the humans. I mean, it really makes you think about how we train doctors, right? If AI can actually help them see things differently, avoid those mistakes that we all make, shouldn't we be teaching them about this stuff from the very beginning?
Yeah. I mean, why wait until they're already out there practicing to show them this game-changing tool? What if med schools built AI into the whole curriculum, taught them how to use it the right way? Alongside all the other stuff they learn.
That's a really cool idea, and I think it speaks to this bigger shift that's happening in healthcare. It's not about AI replacing doctors, right? It's about AI making them better at what they do. It's having this brilliant consultant you can call up anytime.
Yeah, exactly. It's not man versus machine. It's like man with machine working together to figure this stuff out. Right, and think about what this could mean for global health. You could have these amazing insights available to doctors everywhere, no matter where they are or what resources they have.
That's huge, especially when you think about all the inequality in healthcare. You know, all the challenges of getting good care to places that need it most.
Absolutely. And
Yeah.
this is just the beginning. As AI gets even smarter, we're going to see even more tools and applications.
Yeah.
You know, it's just the tip of the iceberg.
It's exciting, but it also makes you wonder about the downsides, right? Like, what about relying too much on AI? Could it actually make doctors worse at thinking for themselves?
Yeah.
Less able to develop those critical thinking skills?
That's a really good question. I think the key is finding that balance. You know, using AI but not letting it take over. It should be a tool that enhances human expertise, not replaces it.
So like a dance almost, right? Human intuition and AI's analytical power, each one bringing something special to the table.
I love that analogy. It's
Yeah.
like a dance, a really delicate one, but with so much potential to change everything about healthcare.
Thinking back to that example case, the 76-year-old man with a cholesterol embolism, it really shows how AI can help us see past our own biases,
Yeah, it's like having a second set of eyes, catching things that we might miss, even if we've been doing this for years. It makes us question what we think and consider other possibilities that we might not have thought of on our own.
What if more of those doctors in the study had been using ChatGPT? Do you think they could have avoided some of those wrong diagnoses?
It's a really interesting question, isn't it?
Yeah.
Shows you how AI could not just make diagnoses more accurate, but also make things safer for patients. You know, it could actually help reduce medical errors.
It's kind of mind-blowing when you think about it. It's like AI could be saving lives. And this isn't sci-fi anymore. This is happening now.
It really is an exciting time to be in medicine. Like, we're seeing this huge shift, and the possibilities are endless.
So what are the next steps? How do we actually take all this potential and turn it into something real, something that actually changes the healthcare system?
Well, we need more research, for sure. This study is just a small piece of the puzzle. We need bigger, more in-depth studies to really understand how AI can work in different areas of medicine.
So basically, we need more evidence to make sure we're using this technology the right way, for the benefit of doctors and patients.
Exactly. And we need to keep talking about the challenges, the ethical stuff. Like, how do we make sure AI is used fairly? How do we protect people's privacy? What about biases in the algorithms?
Yeah, those are important questions. It's not just about building the technology, it's about fitting it into the real world of healthcare in a way that makes sense.
And we need to educate doctors about AI. It's not enough to just give them the tools they need to know how to use them effectively and responsibly.
It's like giving someone a powerful piece of machinery without a manual, right?
Exactly. Training and education are key so that doctors feel comfortable using these tools and so they can really make the best decisions for their patients.
It's crazy to think about how AI could change the way doctors are trained, Will it change how patients and doctors interact?
These are great questions, and honestly, only time will tell how this all plays out. But one thing's for sure, AI is here to stay, and it has the potential to completely change healthcare in ways we can't even imagine yet.
It's like we're at the start of something brand new. It's exciting and a little bit scary all at the same time.
It's a journey with a lot of unknowns, but it's a journey that could make healthcare so much better for everyone.
I keep thinking back to that quote from Dr. Rodman in the article. He said that AI should be a doctor extender. It's such a simple idea, but it really gets to the heart of what we've been talking about.
Yeah, it's about humans and AI working together. Each one bringing their strengths to the table to make patient care better and to push the limits of what's possible in medicine.
And in the end, that's what matters, right? The patient.
Absolutely. Improving care, getting better results, and making sure everyone has access to quality health care. That's what it's all about.
And if AI can help us do that, then it's something worth exploring. This whole thing has really got me thinking, if I was that patient in the article, the one with the cholesterol embolism, wouldn't I want my doctor to have every possible tool to help them figure it out? Wouldn't we all want that extra layer of, insight, especially when it comes to our health?
Yeah, it's a good question, right? How comfortable are we really with AI, being part of our healthcare?
Yeah.
It's something we're all going to have to think about because this technology, it's not going away.
Yeah, it's not just some futuristic what if anymore. This is happening now. And as AI gets even more, advanced and becomes more a part of the healthcare system, we're all going to have to figure out what it means for us.
And like with anything new, there are going to be some growing pains, right?
Yeah.
We got to figure out the best way to use AI in healthcare, make sure it's done ethically, make sure patient safety and privacy are always top priority.
Right. It's about finding that balance, using the power of AI, but not losing those things that make us trust doctors and feel good about our care.
Exactly, because at the end of the day, AI is just a tool. It's up to us how we use it.
So what's the big takeaway here? What should people be thinking about after listening to all this?
I think the big thing is that medicine is changing in a big way. AI has the potential to change everything, how we diagnose and treat diseases, how we discover new drugs, how we personalize care.
Feels like we're at the beginning of something totally new, like a new era in healthcare with so much potential.
And it's up to all of us, doctors, patients, researchers, everyone, to work together to use AI for good, to make healthcare better for everyone.
That's a great point. Well, this has been a fascinating deep dive. I know I'm going to be thinking about this for a while.
Me too. And to all our listeners out there, we want to hear from you. What are your thoughts on AI in healthcare? Are you excited? Do you have concerns? Head over to our website and let us know in the comments. Let's keep this conversation going.
And that's it for this deep dive. We'll see you next time.